All right, so today we're going to go over chapter 34, immunity. We're mainly going to focus on adolescents and pregnant people and immunity. So by the end of the class, you'll be able to examine the management, schedule, administration, and nursing considerations about immunizations given during pregnancy and to infants, children, and adolescents. Discuss the CDC recommendations for immunization from birth to adolescence. Okay, and just a reminder, this is chapter 34. Okay. There's also a link to the CDC website. It's basically everything the same thing that's in here. It's just a pretty graph. I linked it in the Canvas. It's on the web links as well. So an immunomodulator affects the body's defense and may suppress or stimulate the body's defense. So it's just how the body defends itself against illnesses. Okay, so the innate or non-specific body defense and immune response, it's like the first line of defense, barrier to microbes or environmental hazards, deny entrance to pathogens, general responses that are not specific to a particular threat. So once it's your skin. Okay, so it's like your body's natural defense is one of them is your skin. Okay, so until you get a cut, it's supposed to deny the entrance of pathogens. Like I said, it's a non-specific response, so it's just there, right? It doesn't have like a specific response. Oh, I saw this one bacteria, let me attack it this way. It is consistent for everything. Okay, it's just a barrier. Example, skin, phagocytes, natural killer cells, the complete system, fever, interferons, and inflammation as well. So the adaptive or specific body defense is the second line of defense, and that is your immune response. So lymphocytes interact with the antigens. So once especially after the lymphocytes have learned what the antigen is, it creates a very specific response. It knows how to kill it because it's been exposed to it before, if that's happened. So there's antibody mediated, and then there's cell mediated. These are just divisions within the immune system. Okay, so the antibody mediated is initiated when antigens encounter B cells. Activated B cells divide and become plasma cells that secrete antibodies. Plasma cells then secrete the antibodies, the immunoglobulins, neutralize a foreign agent, mark it for destruction, and then so the peak production occurs in about 10 days. Memory B cells can speed a further defense. It learned what killed it last time. It learned how to kill it. So instead of taking 10 days, now it takes 2 to 3. So your active immunity. This is important because this is how your body is having a defense against things. Okay, so this is the immune system is stimulated to produce antibodies. This is exposure to antigens and produce immunity. So this is vaccinations, boosters, actual infections. Okay, having an actual infection and then learning how to kill it, that is the active immunity. That is the purpose of the vaccine. The vaccine gives your body a small dose of whether it's live or not live, it's a small dose of the infection, and then your body learns how to kill it, and so now you have active immunity against it. Okay. Passive immunity is how I get it from someone else. I didn't make these antibodies. Okay, so these are performed antibodies transferred from one individual to another. So usually like a mom to their fetus. Okay, and then when the fetus is when the baby is born, even through breastfeeding, you can have passive immunity as well. Immunoglobulin, treatment of botulism, tetanus, and rabies are all passive immunity. Okay. For people who are exposed or have a high risk, for immunosuppressed people, sometimes they have to get the immunoglobulin transfers and things like that, so they can get the antibodies without getting the vaccine. Okay. All right. So vaccine schedule. We play a key role in it. We're gonna implement and teach patients about the vaccination schedule. Pregnant women can receive inactivated vaccines after 12 weeks of pregnancy. So the flu shot, COVID, if they want to get those while they're pregnant so that they can have, it's very important that they probably get the flu shot. COVID and the flu and both of those shots, it all depends on the time of the year. Okay, but they have to wait till they're 12 weeks pregnant. The live vaccines have to wait till after pregnancy. Okay, they cannot have any live vaccines. Okay, so we have DTaP, which is diphtheria, tetanus, and pertussis. Okay, which is different than Tdap. These are two different medication formulations. Okay, they do protect against the same thing, but they are different. Okay, the DTaP, sorry, is an IM injection at 2, 4, 6, and then 12 to 15 months. Okay, the Tdap is what adults get, and children over 7. You have to be over 7 to get the Tdap. So the infants cannot get this one. And small children. They usually give this one about 11 to 12 years old. And then pregnant women get it every pregnancy in the 3rd trimester. Okay. Like we said, in sexuality reproduction, the Tdap is super important to get for passive immunity for the baby, to have passive immunity against the diphtheria, tetanus, and most importantly, the pertussis. Every pregnancy. Doesn't matter if I had a baby in 2023 and now having another baby in 2024, I have to get a Tdap both times. Okay, 3rd trimester. So influenza B is a lot of times what this is called is influenza B. This is an IM injection that's given at 2, 4, 6, 12, and 15 months. Okay. Hepatitis A is given at about 12 months. And then 6 to 12 months later, it is an IM injection as well. Hep B is given at birth. It is also IM at birth. Okay, and then the important thing, it says 1 to 2 months, 6 to 8 months later. So what it means is that you get it at birth, they need to have their 2nd dose either at 1 month or at 2 months from the 1st dose. Okay, and the 6 to 18 after the 1st dose. So if I get my 1st dose at birth, I need my 2nd dose at 1 or 2 months. If I get my 1st dose at birth, I need my 3rd dose at 6 to 18 months. But let's say I didn't get it at birth. My parents didn't want me to get it. I waited until I was, 3 months old. Then we would start it from there. It's 3 months, and then a month after, and then 6 months after the 3 months. Okay. So it all depends on when the 1st shot was. That's what's important. Okay. So human papillovirus, which is like, it's Gardasil, HPV. Okay. It protects against HPV. So HPV is a type of warts, and then you can have the normal kinds of warts just like on your fingers, or you can have genital warts. That's all the same kind of HPV. But Gardasil will protect against the HPV and hopefully prevent you getting cervical cancer. It's very important for women to get it and men, because all children really, because a lot of times boys are carriers and don't know it, and or especially women, because a lot of times it's internal and you have no clue. But having HPV, especially genital HPV, does have a very high risk to cervical cancer. So it's important for everyone to get it. But we start at 11 to 12 years old. It used to be that you had to be previously not sexually active, but that's not true. You can technically get this when it was still new. People could get this up until they were 26 years old. So if your parents didn't want you to get this shot because they didn't want to expose you to it, I know adults who get this vaccine, and that's okay. So, but we can start as early as 11 to 12 years old. Okay. And then again, you need another dose, either 6 months to a year after the 1st dose. Okay. If you start after 15, you have to do a 3-dose schedule. Okay. So if you start at 11 to 12, it's 2 doses. If you start at 15, it's 3 or older. So, influenza. the flu vaccine. It's an IM injection. You can get it children can get it at 6 months, and then just an annual dose every year. Okay. But you have to be at least 6 months old to get it. MMR, or measles, mumps, and rubella, it's a sub-Q injection. Okay. It's given at 12 to 15 months, and then again at 4 and 6 years. The meningococcal conjugate vaccine. So this is an IM injection at 11 to 12 years old, and then at 16. And then we have the pneumococcal, which is for pneumonia. It is given to children, the Prevnar IM 4 doses at ages 2 months, 4 months, 6 months, and 12 to 15 months. Adults can get this as well. I think you know that from Pharm 1. I got the Prevnar, or the Pneumovax, when I was like 20 something, because my titers were low. So and adults can get this as well. So inactivated polio is given subcutaneously at 2, 4, 6 to 18 months, and then 4 to 6 years. And then varicella, which is chickenpox, not to be confused with shingles, which is also a type of varicella vaccine. It is not the same. The chickenpox vaccine is an IM injection at 12 to 15 and 4 to, I'm sorry, a sub-Q injection. It is also sub-Q at 12 to 15 and 4 to 6 years. Actually had to get this before I was getting out of nursing school because I never got my second dose or something. And it is a sub-Q injection. This is true for both the varicella and the shingles vaccine. So it's sub-Q. I got it in the back of my arm. I think I got it at the pharmacy, which is fine. But my whole arm broke out and like it was so hot the next day, and it was red. It was a little raised, and that is actually a normal reaction, and it was perfectly fine. I would talk to the pharmacist. I was like, excuse me, why does my arm look like this? And she said, that's actually pretty normal. A lot of people have it. She told me to take ibuprofen to help with the inflammation, and that's what helped. It didn't hurt. It was just hot. And then you could use it like a cold compress if you really wanted to, but I was at work and couldn't do it. But just the ibuprofen or like a cold compress is good. All right, so the rotavirus, this is an oral liquid, okay? It is, I'm sure they flavor it so it tastes well, but it's 3 doses at 12, 4, and 6 months, okay? A lot of times for the kid, they come in like these little plastic droppers, so it's just like one little dropper. Make sure you put it in the back of the throat. They swallow it all, and it is it's just they just squeeze the whole little liquid in there, and then they drink it. The rotavirus is a horrible diarrhea. It's sometimes from eating, like drinking bad water, things like that. So it just protects them from having the really bad diarrhea. So the reason I give it to children, especially small children, is that you can become easily dehydrated and they don't know. And we just don't want them to have deadly diarrhea. All right, so RSV, this is a new vaccine, the respiratory cyclical virus, okay? This is a new vaccine. It just came out within the last year. So they have actually got this for my child. I wasn't able to get it, but a lot of times if you're pregnant, you can get it. And then you give the passive immunity to your child, especially if you're having a child between October and March, because that is RSV season. It falls around flu season. So if the first dose depends on the maternal vaccine. So if the baby was born between October and March and the mom didn't get one, and you don't know if she got, or you don't know, you need a dose at 1 week of birth. So their first appointment, their 1 week appointment, they need a dose of the RSV. This is optional. This is not a required one, but this one does save lives. I mean, RSV is a horrible thing to watch your child go through. It is not fun. So if the mom got it and then gave birth within 14 days, so if I got it on a Sunday and then I had my baby before the 14 days, I need another dose because I haven't gotten the full immunity for the fetus. By now the baby. Okay, so now if I've gotten it and it's been more than 14 days, there's no dose needed. And if the baby was born through April to September, if the mom got it, great. But if it was less than 14 days or she didn't get it at all, they said just get it right before RSV season, which is October to March. All right, and then we get into COVID vaccines. Your children can get COVID vaccines as well. The first dose that you're eligible to get it is at 6 months, and then you get it yearly. But they have to, it's just like the flu vaccine, you have to be at least 6 months old. All right. So then we have, I'm sorry, cell-mediated immunity. So we've talked about active immunity and all the different types. This is cell-mediated. So this is when your helper T cells. So this is what activates the other immune cells, and then your cytotoxic T cells travel through the body, killing bacteria, parasites, viruses, and cancer cells. So something activates a very specific T cell, and then they're brought out to kill whatever's there. Then there's cytotoxin secreted by the T cells, hormone-like proteins that regulate intensity and duration of immune response, mediated to cell communication. So these are like interferons and interleukins, if you've ever heard those. And this is a little bit more about the Hep B vaccine, okay? So we use it for infants who, it's to protect against hepatitis B vaccine. Hepatitis B. It's, you can have antibodies as soon as 2 weeks. The peak is 6 months, and then immunity usually lasts 5 to 7 years. The most common problems with a lot of these vaccines is pain at the injection site. I've always been told to get it in the opposite arm because I was like, oh, I don't want to move my arm too much and it hurt. But that's actually not true. You should really get it in your dominant arm, because then the more you move, the less sore that muscle is. So if you can convince someone to do it that way, I believe it's better. So you can have mild to moderate fever and chills with a lot of these vaccines. A lot of people might have like a low grade fever or chills even. Tylenol, ibuprofen is perfectly fine. Minor symptoms such as fatigue, dizziness, fever, headache. If you are allergic, you can get urticaria and anaphylaxis. So other immunosuppressants will decrease the effectiveness. So if you're on immunosuppressants, getting the HBV vaccine, HBV will not help. Okay. There's no overdose, no foods that we're worried about. If you have a hypersensitivity to yeast or the hepatitis B vaccine, you shouldn't have the hepatitis B vaccine. If you have get hypersensitivity or an allergic reaction after the first dose, you don't need this. You should not have the second dose. And we've already talked about the schedule for this. So the first dose, you get the first dose. The second dose is 1 month after. The third dose is 6 to 18 months after the first dose. Okay. So give it in the deltoid unless contraindicated. So have epinephrine available, especially if they do have a hypersensitivity. Monitor for fever, chills, and teach about anaphylactic symptoms. With most injections, it's common that you keep the patient 15 to 30 minutes after I give it an injection to make sure they don't have an allergic reaction. I've seen that happen with antibiotics. Even like if you give someone an injection of a medication and they're getting discharged after, or they're done, you need to keep them for 15 to 30 minutes, because if they have an allergic reaction, you need to know. Okay, and it happens really fast, and then it's over. Okay, so that's immunity. It's not much to it. It's really the immunization schedule, and then the pregnancy schedule for immunizations as well. If you have any questions, refer to your CDC chart, put it on the discussion board, email me if you need to, but that's really it, and we are done. And have a good one.